All right, welcome, Linda, to a Pat Chat. We're here today to talk about the heart. So you've been, first of all, Linda Cripe is an MD from Nationwide Children's Hospital, and before that from Cincinnati Children's, and that's where we met. So Linda, tell me why you've been interested in Duchenne specifically, as well as heart disease in children. Tell me where you sort of landed so that you would really focus completely on Duchenne hearts.
All right. Thank you. First of all, I'd like to thank PPMD for the opportunity to talk to you guys today, and Pat, it's truly an honor. It's an interesting question. I was struck by the cardiovascular disease in Duchenne muscular dystrophy maybe 15 years ago, maybe even longer than that, when I was at Cincinnati Children's, and it was very clear to me early on that the heart was being ignored in Duchenne muscular dystrophy. And ignored is a big word, but it may be accurate. We're all very focused on the skeletal muscle disease because we can see that. But the heart is a muscle too, and a really important muscle. And unless we approach the care and the treatment of the heart, we are not going to impact the morbidity and mortality in this disease.
So Linda, do you think, it seems to me that obviously you're right about skeletal muscle, we can see it, and so therefore it's weak and we notice it. But how much, or do you think the heart's inability to deliver volume to muscle impacts the disease course itself?
Oh, that's a really outstanding question, and an important one too. I think it impacts it tremendously. I think if you don't have a good, what we call cardiac output, if you don't have good delivery of blood to the skeletal muscle with the oxygen that it needs, I think you're going to impact the skeletal muscle negatively. So, it's all a partnership, and they work hand in hand. So making sure that you have good cardiac function will ensure that you have good skeletal muscle muscle function.
And if, as we use medical tools and as life changes and we see approvals and maybe even a gene therapy approval at some point, do you think that extending that ambulation or for years and years is going to negatively impact the heart?
Well, that's another good question. It could. I think it really could. And we obviously don't know that answer for sure, but I do think that ambulation clearly puts a daily strain on the heart. You're asking that muscle to perform in ways that raise the blood pressure, and make it work harder. And so I think that long term you could negatively impact cardiovascular function.
So we've agreed to fund the Action Network. Can you just tell me a little bit about Action, where it started, what it is, and why it's important?
Yeah, Action was started at Cincinnati Children's Hospital by a group of incredibly talented heart failure specialists led by Angela Lortz, or Angie Lortz as she's known. And it's a network of experts around the United States that specialize in pediatric heart failure, who have come together to address some important issues for children who have other cardiovascular disorders. And we are incredibly fortunate to be able to tie Duchenne into that network.
So they've carved out a piece of the network to really focus on Duchenne?
Yeah, they because Cincinnati Children's has a long-standing history in caring for patients with neuromuscular disorders, specifically Duchenne muscular dystrophy. I think that passion bled over into this network, and Chet Villa is spearheading those efforts and doing an amazing job. But they are able to take lessons learned and structure for clinical trials and data collection and apply it to kids with Duchenne.
It's pretty amazing that there are so many cardiologists involved now and seem to be focused on Duchenne. That's a big change from when you started. Is that right?
It's a tremendous change, and I think that's what it takes. Malcolm Gladwell has this book called The Tipping Point, and I think that we've reached the tipping point now in the care of the heart for kids with Duchenne muscular dystrophy. It takes manpower, it takes brilliant minds thinking about the issues, and I am over the top thrilled to say that my colleagues in the field of pediatric cardiology are now engaged in the field of Duchenne muscular dystrophy with a passion that we haven't seen for a long time. And I'd also like to pause and say, I really think it's a tribute to Parent Project Muscular Dystrophy. And I mean that with all my heart as a cardiologist, in the sense that it took that push. And PPMD has been pushing the cardiology field for a long time, trying to get cardiologists to engage. And I think it's finally been successful.
It's amazing to see. And I'm hopeful that these hearts are going to beat long and strong for a very long time. So thank you so much for joining us today, Linda. That's wonderful. And all the work you've done has gotten us to the tipping point. So thank you so much.
Well, let's keep tipping. Thanks.
That's right. All right.